giáo sư Okleoh, chuyên gia tư vấn cấp cao về da liễu, giáo sư lâm sàng của khoa Y tại Đại học Quốc gia Singapore. Một chút thông tin về giáo sư Go thì giáo sư tốt nghiệp ngành Y tại Đại học Quốc gia, Đại học Singapore vào năm 1974. Hiện bác đang là chuyên gia tư vấn cấp cao và là bác sĩ da liễu tại Trung tâm Da liễu Quốc gia National Skin Central, đồng thời là giáo sư lâm sàng tại khoa Y Đại học Quốc gia Singapore và là giảng viên thỉnh giảng tại trường Y khoa LKC tại Singapore. Giáo sư hiện là thành viên của nhóm nghiên cứu thuộc Hiệp hội Viêm da Tiếp xúc Quốc tế. Bác đã xuất bản hơn 300 bài đăng trên các tạp chí khoa học, tham gia biên tập và viết nhiều cuốn sách tham khảo về da liễu. Tới với hội thảo ngày hôm nay thì giáo sư Go sẽ mang đến cho chúng ta một hướng tiếp cận mới trong việc làm sáng da và điều trị tăng sắc tố bằng đường uống. And now please welcome on stage Professor Go Okleoh.
Thank you very much. First, I want to thank New Asia for inviting me to give this talk. And it's always a pleasure to come back to Vietnam. I've been to Vietnam, I don't know how many times. I've traveled from all the way from the southern island of Phu Quoc up to Sapa. Everywhere I've been, it's a beautiful country. The people are so beautiful and the food is excellent. We like your local fur. All right, I'm going to talk about fern block or leucotomas, polymodium leucotomas. And basically there are two talks here. The first part of the talk is about the systemic PLE, and the second part is a study that was done in Korea actually to show the effectiveness of this extract that we are going to talk about. I'm not sure how many of you have heard of oral sunscreen. It all started with the oral sunscreen. We are all trained to use sunscreen by using topical sunscreen agent. But in the 1980s, in fact, they discovered that you can have some form of oral sunscreen that helps you to protect against the UV light. However, its effect is not very strong by itself, and you still need to combine them together. And subsequently, since the 1980s, the late 1980s, there are many studies that have been reported. And I hope at the end of this lecture, you all have something to bring home to change the way you practice the prescription of anti-aging skin, sun protection agents, considering systemic treatment as well. This is what we are trying to prevent. We are trying to prevent photo-aged skin, as you can see on the left side, and then the aged skin over the years as you grow older. And then in local context, in the Asian country, we have a lot of pigmentation. So on top of just wrinkling that you see as a person grows old because of sun exposure, you have a lot of pigmentary changes, and therefore we have actually a very big requirement or demand for treatment of the pigmentary disorders. Now all these changes, as you can see, are the result of UV light, sun exposure. And we are all very familiar with the various components of the electromagnetic wave of the sun energy that shines down on Earth. And you know that it contains a little bit of UVC, very little because it's very toxic to the skin, but we have a lot of UVB and even more UVA. So those are ultraviolet light which are not visible to us, and yet it is there to cause damage to our skin, and we develop photoaging as a result, and I'll explain to you in a short while. But recently, people have discovered that not only UVA, UVB are important to cause photoaging. There's a component called high energy visible light. In other words, visible light is also known to cause photoaging. And in fact, it causes pigmentation. And that is the reason why our melasma patients are not getting better. Every time you treat them with something, they get better for a while, and after that, they don't work anymore. And we used to think that visible light is not important because it has not been shown to cause any pigmentary changes and all that. However, 3 years ago, the Henry Lin's group in Henry Ford Hospital in Detroit discovered that actually visible light can cause pigmentation. And I'll show you some experiments later on. And then now people are looking at infrared light and other blue light to see whether they are actually responsible for pigmentary changes that occur in human beings. So we think of this newer development and newer discovery. Visible light, when you use handphone and your computer screen, to really enhance pigmentation and cause pigmentation. Do we need a protection there? So we know UV light, especially UVB, UVA light, cause damage through the effect on the release of reactive oxygen species, in short we call ROS. And reactive oxygen species cause a lot of damage to the skin, and that's how we get our photoaging skin. And when we use photo sunscreen, we are actually trying to prevent this from happening. So the oxidative stress of the reactive oxygen species lead to pigmentation. It leads to DNA repair mechanism defect, and you get skin cancers as a result. And then of course you get degeneration of collagen due to its effect on the metalloproteinases that cause wrinkles, and that's how we get the whole total picture of photoaging. And if you see a Caucasian, you see that they usually have very severe photoaging skin for their age. Yet the Chinese people, they don't have as much because the Asian patients tend to avoid the sun, and therefore they don't get. So you can see that the UV light, UVB light, UVA light can cause all these changes as you can see over there, and then it leads to inflammation, and it in fact affect the immune system of the skin as well. But all the while when we use sunscreen to treat our patient, we never thought of all these other mechanisms that is happening. We just think of something that will filter away the wavelength of light, and then systemically if there are some changes, we don't take care of it. And it's time for us to change the way we prescribe sunscreen, especially if we know that sun UV light can cause some other type of damages other than just simple UV effect. So in fact, there was a very recent study that was done that was published a few days ago in this one of the computer journal, Frontier in Medicine. And they examine all the publications and get the personal opinions of various doctors, dermatologists as to how do we look at sunscreen, how should we use sunscreen, and they have come up with a recommendation and consensus that we should not just be prescribing sunscreen as a filter. We should think of treating the patient on how to prevent photoaging in the process, because the combination treatment can give you actually added effect and added outcome in improving skin textures, removing wrinkles, removing pigmentation, and then reduce the new vascular formation and prevent skin cancer as well. You must look at it in total as a whole picture. And that brings us to this substance that we are going to talk about today. It's polypodium dichotomous. And this is actually a patented product, but there are many companies now that are producing the similar extract and claim to have as good a result, if not the same. And this is actually an aquatic plant that is found in Central America, in New Mexico country. And they found this fern tree actually has got natural protection against the effect of UV light, where they find that local people use it as a medicinal plant. And from then onward, they started to do some experiments to find out what are the characteristics that cause this prevention. And they found that actually in this extract of polypodium dichotomous, it contains a lot of antioxidants, very powerful antioxidants in the extract, and that is believed to be one of the underlying mechanisms. So if you take a lot of antioxidants, you actually help to remove a lot of ROS, reactive oxygen species, because there are a lot of electromagnetic energy, even visible light. There's no sunscreen that can filter visible light at the moment. And most of the sunscreen that you see actually contains antioxidant as a surrogate preventer of UV light activities. And if you use a lot of oral or topical antioxidant, you can actually then filter out some of the effects of visible light. Now the company, which is Cantabria Lab, and in association with the New Asia, has come up with a certain combination, because now remember I was told in the beginning that if people are thinking of combination treatment when they are treating photoaging, photopigmentations, and the various photoaging phenomenon, you want to have a total package, a holistic treatment. And they have actually added in other substances in addition to the fern block. Fern block is the polypodium dichotomous. And now they have a new combinations that contains glutathione. I'll talk about glutathione in a short while. It contains nicotinamide, which is a very, very old anti-inflammatory agent, which if you look around any creams, they all contain some anti-inflammatory agents called nicotinamide. And they have also added rosemary extract, which is also an antioxidant. So they are enhancing the effect of the antioxidant of the Okleoh range of products in this range of treatment. And we are now talking about systemic treatment now. We're not talking about just topical treatment, although video care has got topical sunscreen and topical cream that has got this kind of effect as well. So the systemic treatment is generally more effective and more powerful because it's a systemic treatment. And what does it show? In many of the studies, in the recent studies of polypodium, there has been a lot of studies being done in Asia as well as in Western countries. It protects against visible light. Right? There are experiments which I'll show you in a while that can prevent the visible light, which I told you just now, cause pigmentation in Asian skin, and if there's no filter at the moment and we have to use antioxidants. So if you give a group of patients with this polypodium extract, and then you compare to those people who do not take, then you'll find that the visible light effect is gone, and you can block it. And this is only seen in Asian patients. And it includes our standards of melasma treatment, which I'll show you some figure again in a short while. And it also protects against blue light. I think you all have heard about blue light. This is a wavelength of light that is emitted by your TV, your handphone, and people say if you use your handphone too often, will you get some degenerative change? At the moment, we do not know actually, and there's no study to show that it causes any severe damage at the moment, and therefore there are still a lot of studies going on about that. But to be cautious, a lot of people are trying to avoid the blue light as well, but it's very difficult to avoid. It protects against the damage that cause changes in the DNA and therefore block carcinogenesis from happening. So this publication has been shown to be quite effective, and I'll show you some of them as we go along. So here is one of them, visible light. And they show that one of the effect of visible light that is quantifiable is to look at the degree of pigmentation. So in this study, they look at the visible light. One group of patients were given polypodium hippocampus extract. One group of people were given placebo. Then they exposed them to visible light. And they found that the group that received visible light, received polypodium hippocampus, did not have much pigmentation developing, whereas the group that received only placebo has got darkening of skin on exposure to visible light. And therefore it tells you that there is some effect of polypodium hippocampus in blocking visible light. And that's again the scientific proof, and you can see the pigment-free index went down when you are taking it. So if you don't want pigmentation, you can do that. Now this is a study that we did at the National Skin Center where we look at patients with melasma. These are people who come to us melasma and they have been given all sorts of treatment, and you all will know that all the melasma patients, they will come to you repeatedly, or they will go from doctor to doctor because the first time treatment they will get slight bad improvement, and after a while they lose the effect, they don't want to do anything anymore. So they will ask you whether is there anything else better. So we have a group of melasma patients who did not respond to treatment and wanted other treatment. So what can we offer them? So we did a study on these 33 women with melasma. And one group of them actually received polypodium hippocampus, and another group of them received just placebo with sunscreen and hydroquinone. And we followed them up over 3 months. That means they take for 3 months, and then we assess them, look at the MASI score, and see who got better. And then we published this finding in a journal. And we found that the group of patients who were receiving polypodium hippocampus, the melasma severity index actually went down. The score went down, and then you can see compared to placebo, the absolute value goes down. But if you look at the delta value of the differences between the two, you find both of them actually does cause reduction of melasma. But the one that received polypodium actually has got lower MASI score as a result. So if you have nothing else to offer the patient, this is something that you can offer to your melasma patient. And we try our topical treatment, and you can combine that with polypodium hippocampus extract. This is an example of 2 patients. The one on top did not receive polypodium hippocampus. She received actually the placebo. And the patient below received polypodium hippocampus. And you can see the difference in the melasma. So you can see the melasma is sort of reduced by polypodium hippocampus in the group. And if you look at the score, it's all the same as well. And if you look at the literature now, if you refer to the literature, PubMed or what, you'll be able to see there are quite a number of publications that show that polypodium hippocampus extract in the form of video care is able to reduce pigmentation in particular melasma, because melasma is one of the difficult things for our patients to treat, and we just offer them as a supplement and they will just take that for as long as they need to take it. As far as blue light is concerned, it is not a direct evidence at the moment. It is actually an experimental study to look at the cytokines in the skin. And they found that if you take polypolis recombinant, you are able to suppress auxin level, which is a mediator of increased melanosome formation. And indirectly, they say, okay, it can help to prevent blue light. But in reality, we do not really know whether there is a problem with the blue light, although it's been seen to show it produce more pigmentation in some group of patients. So this is something that you have to watch out for. What about DNA protection? When you are treating patients for sun exposure to prevent against UVB, you want to think about the prevention of skin cancer because we know that UV light actually can increase skin cancer in the long term. And you can see that actually when you do experiment on skin biopsies of patients who are exposed to UV light, you have this increase in CBD, which is a cyclobutane pyrimidine dimer, which are the precursors of skin cancers. And if you feed patients with polypolyl dichotomous and you measure the CBD level, you find that it is not increased with the UV exposure, showing that it can help to prevent mutation and skin cancer formation. And again, if you look at the studies, there are many studies to show that you can reduce the incidence of skin cancer by taking polypolyl dichotomous. What about anti-aging? When you treat a patient with sunscreen and all that, we hope that you can prevent anti-aging, slow down the process of anti-aging, which consists of skin wrinkling, which consists of increased pigmentation, which cause saddle changes, vascular changes, and all that. So you would like to reduce wrinkle at the same time. And again, polypolyl dichotomous patients, and this is again comparing in animal experiment, looking at the collagen, the fibroblasts secreting as collagen, that the patients who take polypolyl dichotomous actually can prevent the matrix metalloproteinases from increasing in the tissue. And you know, the matrix metalloproteinases is responsible for collagen breakdown. And when the collagen breaks down, you get wrinkle formation because there's no more supporting structure. And you can see that on the right-hand side, the picture shows a very healthy collagen. These are people who receive polypolyl dichotomous. And in the middle are the fibroblasts and collagen breaking down to bits and pieces. This is due to the metalloproteinases activity of the UV light. So you can actually prevent it by making the patient take some polypolyl dichotomous. And again, there are scientific studies in the literature, PubMed, you can look at it, to support that polypolyl dichotomous extract actually does help to reduce breakdown in collagen in the skin. Now, they have actually added a few other substances, as I told you earlier on. This is to enhance the effect of the polypolyl dichotomous by itself, and therefore they have increased the content to achieve better outcome. The glutathione, I think you are very familiar. It is not approved by the government in many countries for intravenous injection, but the oral tablets and the topical treatment is approved in many places, and in fact they are available as an over-the-counter product. And it has got a very effective effect on melanogenesis. It reduces productions of melanin by the melanocytes. It inactivates the tyrosinase by chelating copper ions. It interferes with the transfer of tyrosinase premelosome to the keratinocytes. Actually, it has got a very good whitening effect in a lot of patients. And so this is something new. And this has been added in as a potent antioxidant in the newer polypolyl dichotomous capsules. And you can see that there are various studies that have been done giving patients with the glutathione containing polypolyl dichotomous, and you can see that there's a significant reduction in the melanin index, reducing pigmentation, so it will be very useful for melasma as well. The other product which is very important, the old product is nicotinamide, is been present in a lot of cosmetic products for a long time. And one of its most important functions of nicotinamide is its anti-inflammatory property, and it is naturally available. And it also prevents the transfer of melanosome. Most of our pigmentation actually occurs because of the transfer of melanosomes. The melanocytes produce melanosomes. The melanosomes are then transported by the dendrites of the melanocytes to the keratinocytes and then transfer across the cytoplasmic membrane into the cytoplasm of keratinocytes. And that's how we get our pigmentation. And if you count the number of melanocytes, in a lot of people, the melanocytes is not increased, but the melanosomes is bigger, the melanosomes are more, and they get transferred into the epidermis, and that's why we see increased pigmentation. So nicotinamide is supposed to block that, and therefore, if you add this into your anti-pigmentary treatment or anti-aging treatment, you will get benefits from that as well. And the rosemary extract basically is the same thing. It's an antioxidant that is found in large quantities in the extract of the plant, and they actually complement that of polypodium hippopotamus and other antioxidants like glutathione and nicotinamide in the capsule. So this is actually a summary of what we are doing now. If you prescribe Hidrocare luminance, which is a combination of polypodium hippopotamus, nicotinamide, glutathione, and rosemary extract, you are actually combining all the effects of photoaging into a capsule, and then you prescribe that for your patient. And there are many experimental scientific studies to show the efficacy of the individual item, and therefore they may have some effect that you can offer to your patient, especially patients not responding to your treatment. And the last part of this talk will be on the efficacy of oral polypodium hippopotamus in reducing pigmentation in Korea. They are doing a study, the paper is not published yet, but I thought we can share some findings with you. And these are actually 25 to 60-year-old patients, and they are actually given exposure to sunlight, and then also they are given the treatment, 26 active groups that receive the polypodium hippopotamus, and then another 12 control groups receive only capsule, and then they then follow them up at T0, and 1 month later, 2 months later, and 3 months later to see whether those who receive the group actually has got better outcome in terms of this overall photoaging effect on exposure to the sun. And this is what they found, pigment intensity, which is one of the features of photoaging. In the beginning, baseline, you can see that they are about the same in terms of melanin index score. But as you go down until the third, fourth month, you can see that those people in dark green who receive polypodium hippopotamus has got less intensity. This is an objective measurement with the maximeter on the spots that the patient has marked for pigmentation. So it does help to reduce the intensity of the pigmentation. And then the brightness. The brightness is the shininess of the skin, the reflective appearance of the skin. And the more shiny it is, the better, the healthier the skin is. And they found that patients who took the polypodium hippopotamus actually has got better brightness of the skin. And this is measured with a spectrophotometer on the reflectance properties of the skin to specific wavelength of light. Skin firmness and elasticity again is part of the photoaging process. Firmness meaning that the skin is not so stretchable. We all, as we grow older, you find that the skin starts to sag, we have a bulldog face and all that. And the reason why that occurs is because of loss of collagen tissue, loss of elastic tissue. And you can measure that using a cutometer. Cutometer is a device that sucks the skin out, and then they can measure the depth. You can suck out the skin at a certain temperature. So you can find that if you are very saggy, then the measurement will increase. And then the elasticity is measured how quick the skin bounces back. You pull the skin, you let go, and then you can measure the period taken by the skin to bounce back. The more elastic it is, the better it is. The older you are, the less elastic. Except that old person, you find the skin sagging and all that. So again, you can see that people who take polypodium hippopotamus and the antioxidants has got the better elasticity at the end of the treatment as compared to those who do not. And measuring of wrinkle area is the same thing. You use a profilometry where you use a special plaster to put on the skin, and then you calculate the valley and the heel to see how much of it is. And again, you can get a figure that again you can see those patients who receive polypodium hippopotamus actually will have a better reduction in wrinkles than those who do not. And here's a very interesting feature that they found that with the oral medication, when you measure the transepidermal water loss, again, those receiving it has got better transepidermal water loss. What is this transepidermal water loss? Transepidermal water loss is a measurement of skin barrier function. If your barrier function, cytopenia, is very good, then your transepidermal water loss will be very low because water cannot come out of the surface of the skin, and it sort of becomes protecting the hydration of the skin. So there are a lot of things that we do, ceramides and all that in our cream to try to prevent all this loss of water to the surface of the skin. This shows that if you take oral phlebotomers, you can actually achieve a similar result as compared to the placebo. So the conclusion is that you can get very good outcome in terms of pigmentation, in terms of elasticity, in terms of wrinkles, in terms of firmness of the skin, and improvement of barrier function by taking the polypolymer technology. And this is the last slide to show you. It helps in post-inflammatory hyperpigmentation as well, which is something which is very good for children. I just want to make an advertisement that we are organizing a small laser meeting in your beautiful city of Da Nang on the 2nd to the 4th of May. So please come and join us and have a nice meeting for those of you who are interested in it. Thank you very much.